All week, provincial premiers have been announcing plans to lift public health measures. Some provinces, like Alberta and Saskatchewan, have already announced they're scrapping vaccine mandates, testing requirements, and public masking. And the federal health minister on Friday said he and Dr. Theresa Tam will be announcing changes next week to Ottawa's border testing measures. Joining me now from Montreal to look at what's happening and where things are headed is Dr. Christopher Labos. Dr. Labos, thanks for taking the time.
My pleasure.
Can we ask, let's start with that specific question about one of the things we heard today, and that was that we're going to get some sort of announcement concerning federal measures, border testing. One of the most criticized, controversial measures these days in terms of whether it's necessary and whether it's effective is that second PCR test, the airport arrival test that travelers have to have when they arrive in Canada. What's your feeling? What are your thoughts on that?
So, I mean, in the theoretical sense, the more widely we can test people, the better off we're going to be because you identify cases early and you're able to get people to isolate earlier. It's very clear that if you've already tested negative before you got on the plane, the likelihood that you're going to catch somebody when they're coming off is actually obviously lower. And so in a situation where testing capacity is very limited, I think, people have made the argument that maybe we should be redirecting resources towards more community testing rather than testing at the airport. And I think that's a fair point. I think what we have to be worried about is not taking things too far and saying, let's abolish all testing altogether, because while the threat of a new variant now is relatively low, I mean, there's nothing on the horizon to suggest that. We have to be mindful of the fact that 3 months, 6 months, 12 months down the road, if there are new variants that emerge, if we have no type of border testing in place, then we're not going to be able to at least control or mitigate the spread of a new variant into this country. So it's going forward, it's always a question of balance and reassessment. It's fine to sort of reallocate resources now as long as we have some sort of plan in place to scale things back up should it become necessary at some point in the future.
More generally, if we take a big step back, what are your thoughts as you see both these escalating or continuing protests and the fact that provincial governments are announcing outright the scrapping of vaccine mandates?
So I think it's this. I mean, clearly the situation from the epidemiological perspective is improving. So I think it's reasonable at this point to relax restrictions. And in fact, governments were always going to do this. And this was sort of the plan going forward. What's a little bit hard for me to understand is that if you're going to make the argument that the risk of future outbreaks is less because we have such a high vaccination rate, why would you then want to dismantle the very programs that have encouraged vaccination and keep people safe? So there seems to be a little bit of a logical inconsistency here. I mean, I think it's a fair point to say that vaccines are going to mitigate the risk of severe outbreaks in the future, but we have to continue to encourage people to get vaccinated. There's still a rather large minority of adults who have not been vaccinated. There's still children who need to be vaccinated to make school safer. So there's still some ways to go. So backing away from, encouraging people to get vaccinated doesn't strike me as the best course of action. If anything, we should be encouraging people to get vaccinated so that we don't have to do lockdowns in the future. So there seems to be, at least to my mind, a bit of a logical inconsistency in some of the things that people are saying. Okay,
on a philosophical level, because for 2 years now we've been discussing with public health specialists, with medical specialists, with epidemiologists. We've been talking to people like you. Do you think provincial governments are making their decisions now based more on protests and on a widespread evaluation of public willingness to comply with restrictions? And is that good?
I think some of that is entering into the calculation, definitely. I think you're seeing issues being driven not purely by science, but reflecting the public mood. And that's not necessarily wrong. I mean, you do need public buy-in for any type of major public health measure. The one word of caution, though, is you can't let things go too far because we've been down this sort of road before. We've had situations where governments have announced the end of all COVID restrictions. You had these, open for summer plans and let's eliminate and let's downscale COVID testing because everything's going to be fine. Things may be fine now, but there's always the potential that they may not be fine in the future. We don't know what the future holds. And so the possibility that there might be a future more infectious variant is not outside the realm of possibility. I mean, people were predicting the end of COVID after the Delta variant and then the Omicron variant hit. So we don't know what's going to happen in the fall or next winter. So I don't think it's wrong to loosen restrictions now, especially if there is a public willingness to make that happen, as long as we have a contingency plan in place to be able to reintroduce stuff as it becomes necessary. So the analogy that I've used with people too is that, if you have a flood in your region and you have to evacuate your house, and when the flood is over, you say, well, we're never going to, let's hope this never happens again. I mean, obviously, you hope that it never happens again, but, in the back of your mind, you have to acknowledge that if there was ever a second flood, you would, again, have to evacuate that area. So our response has to be dictated by the situation on the ground, and it can't be driven exclusively by philosophy and by what people want. It has to be driven by the data, and if the data shows a new variant that's causing exponential growth, we have to be ready to respond to that and not, simply be willing to ignore it.
Okay, Dr. Christopher Labos, thank you very much for taking the time.
My pleasure. You take care.